Ever wonder why pain sticks around long after an injury occurs? The truth is, with enough time after an injury, your pain might not be coming from your muscles or joints anymore. It might actually be coming from your brain. That's right, when pain lingers, your brain can go into overdrive with the pain dial stuck on high. But what's really going on here? In this video, we're taking a deep dive into the science behind pain and why it happens so you can understand what's really at play and, most importantly, what you can do about it. Research shows that with trauma, whether minor or severe, it can set off a cascade of changes within the nervous system. In chronic pain conditions like arthritis, whiplash, and low back pain, it's not just about tissue injury or degenerative changes. It's about how the brain and nervous system adapt and respond to the pain signals over time. These neurophysiologic changes are key to understanding why pain can stick around and why it can feel so extreme. One significant mechanism driving chronic pain is a term called central sensitization, a heightened state of reactivity in the central nervous system, including the brain and spinal cord. This increased excitability amplifies pain signals, making the body more sensitive to pain. You see, normally when we experience an injury, the pain signal starts at the source. This is called peripherally mediated pain, where pain signals are sent directly from the injured area. But over time, especially with chronic pain, things can shift. The pain becomes centrally mediated, meaning the problem isn't just with the injury anymore, it's how the nervous system processes and amplifies the pain signals. In chronic pain conditions, we often refer to this as nociplastic pain. Unlike nociceptive pain, which comes from the actual tissue damage, or neuropathic pain, which is caused by nerve injury, nociplastic pain involves dysfunction of the nervous system itself. This dysfunction causes pain responses to be heightened and prolonged, even when there's no ongoing tissue injury. This can persist even when the initial injury has healed or intensified degenerative conditions like arthritis. Now, this seems very theoretical. Is there any evidence to back this up? Well, brain imaging studies have shown that structure of the brain undergoes significant changes in response to long-term pain exposure. Pain processing centers in the brain, particularly areas like the somatosensory cortex, cingulate cortex, and prefrontal cortex, become more sensitive and responsive to pain signals. These areas are responsible for processing the location, intensity, and emotional components of pain. In chronic pain, these areas become overactive, increasing the perception of pain and making it more difficult for the brain to downregulate or turn off the pain response. Also, the prefrontal cortex, which is involved in higher order thinking and pain modulation, often experiences a decrease in function. This can impair the brain's ability to modulate pain effectively and distinguish between actual injury and the brain's perception of harm. Essentially, the brain begins to misinterpret sensory input, exaggerating the pain even when it's not warranted. At the spinal level, the dorsal horn, which is where pain signals enter the spinal cord, can also undergo changes in chronic pain. Normally, pain signals from the periphery are processed in the spinal cord and then transmitted to the brain for interpretation. However, with chronic pain, the dorsal horn neurons can become more excitable, leading to a phenomenon called wind-up. Over time, this causes pain signals to become more easily transmitted to the brain, even with minimal stimulation. Essentially, the pain dial is turned way up. This ability for the nervous system to change is called neuroplasticity, where the nervous system changes its structure and function in response to the ongoing pain. The brain and spinal cord essentially rewire themselves. As a result, what was once a protective pain response ends up working against you, keeping you stuck in a cycle of chronic pain. But it doesn't end there. Chronic pain also has been shown to be deeply intertwined with psychological and emotional factors that can both contribute to and worsen pain. The brain's processing of pain is influenced by a variety of emotional and psychological states, creating a complex feedback loop that intensifies the overall pain experience. For example, when we're in pain, the brain's stress centers, such as the amygdala, become more activated, often causing heightened emotional responses like frustration, anxiety, and helplessness. These negative emotions can in turn amplify the perception of pain. Essentially, the emotional distress caused by chronic pain can make the brain more sensitive to pain signals, increasing the overall experience of discomfort. Psychologic factors like stress, anxiety, and depression can further alter the body's pain processing pathways. Stress and anxiety, for instance, trigger the body's fight or flight response, which increases muscle tension and constricts blood vessels, potentially making pain feel worse. This is because the autonomic nervous system, which regulates involuntary functions like heart rate and muscle tone, can become dysregulated in chronic pain states. Increased muscle tension due to stress can compress nerves, leading to more intense pain. Pain heightens the sensitivity of the nervous system, which leads to emotional stress and physical deconditioning, creating more pain in a never-ending cycle. It's a vicious feedback loop that feeds into itself, which is why people can endure pain for years or even decades after an injury. This is also why traditional painkillers, which focus on peripheral pain mechanisms, often fall short. They don't address the central mechanisms driving pain. Medications like antidepressants and anticonvulsants can target the central nervous system, helping to modulate pain pathways and reduce the emotional and psychological components. Effective treatments must tackle the physical and emotional aspects of pain for lasting relief. Understanding these mechanisms is critical for the development of effective treatment strategies for chronic pain conditions. Addressing both the physical and psychological aspects of chronic pain through a combination of therapies, lifestyle changes, and patient education is key to managing and potentially alleviating long-term pain. Now, if you're interested in evidence-based strategies to manage chronic pain, check out this next video. And if you found this video helpful, be sure to give it a like and subscribe to the channel so you can learn more about your body, how it works, and what it needs to keep moving.